Hello, my name is Brian. I'm a family nurse practitioner, student with Saginaw Valley State University. I'm going to be doing an abdominal assessment on you today. So I'm just going to have you lay back, put your hands to your side. We're going to begin by just inspecting your abdomen. First, noting symmetry, which your abdomen is symmetrical. Next, I'm inspecting contouring. Contouring is appropriate. I don't see any like masses or any uneven areas. Next, I'm looking at your skin. You have a few scattered nevi around, but I don't see any lesions. I don't see any rashes. There's no abnormal venous structures. I don't see any scarring. Next, we're going to move on to your umbilicus, which is showing no signs of bulging, and there's also no inflammation around the area. While I'm looking at this, I'm also looking to see if there's any peristalsis or any type of aortic pulsation that I can notice, which there isn't. Next, I'm going to move on to auscultation. So I'm going to auscultate the 4 quadrants of your abdomen. Alright, bowel sounds were active, they were high pitched, and they're a gurgling noise, which is appropriate. Now I'm going to listen for bruits. We're going to start over your aorta, which is located between the xiphoid process and the umbilicus, slightly closer to the umbilicus. And then we're going to move about an inch to the left and listen for renal arteries. All right, and then we're going to go down slightly below the umbilicus and listen to the iliac arteries on both sides for bruits. And then we're going to go down a little bit lower here and go to the femoral artery and listen for bruits. All right, no bruits were noted. Next, I'm going to listen over your liver, and then over your spleen. So I don't hear any venous hum or friction rub, which could indicate enlargement. Next we're going to move on to percussion. So little bit of dullness heard over the area of the liver and then over the area of the spleen, but tympany was heard throughout just because I had you empty your bladder beforehand, so your bladder is empty, and then bowel loops are filled with gas and air. So is the tympany. We're gonna measure your liver here using percussion. I'm gonna pull this back slightly. So mid-clavicular line here. All right. So right there, and then we're gonna go up. All right, and then from the 2 points, we're going to measure. We're at about 8 centimeters, which is normal liver size for a female. Next, we're going to percuss your spleen here. We're going to go right below, or right in your last intervertebral space. I'm going to have you take a deep breath in. All right, you can breathe out. So what I was checking for there was to see if any dullness was heard when you took that deep breath in, which would potentially indicate that you need to look a little further in to see if there's any splenomegaly. But tympany was heard, so that's once again an appropriate finding. Next, we're going to move on to palpation. So I'm going to start with light palpation, and let me know if you have any pain or tenderness. No? Okay. All right, we're going to go with deeper palpation, about 2 to 3 inches. Alright, any pain with that? Okay, I'm going to do some rebound tenderness, which is where I'm going to press very firmly and then I'm going to release quickly. Any pain or tenderness with that?
No.
Okay, so next we're going to palpate the liver on that right side there. So what I'm going to do is I'm going to grab right around your 11th and 12th rib, and I'm going to have you take a deep breath, and when you exhale, I'm going to press inward and upward. Try to feel the border of the liver there. All right, take another breath in and out. All right. Border of the liver is felt. On patients that are obese, you can use the hook method, going underneath the ribs in an attempt to feel the border of the liver there. And then to check the spleen, I'm going to reach over with my left hand, right at the bottom of your ribs here, and then I'm going to find the rib cage here, and we'll go directly below that, and then we're going to have you take a deep breath in, and then breathe out. I'm going to press in. Alright, once again, take a deep breath in, and then breathe out. Alright, and then I'm going to have you lay on your right side here. Just roll to the side. Oh, I apologize. When we did the palpation, I was supposed to have you bring your legs up and bend your knees. Alright, so hold in the same position. I'm going to have you take a deep breath in, and then out. Alright. Okay, you can roll right back. Spleen was palpable. If you want to bring your legs up like that, that's how it's supposed to be done with palpation. I'm sorry, I forgot to have you go like that. So I'm going to place my hand below your ribs here, and other hand below the midclavicular, or on the midclavicular line, just below the liver border, and I'm going to have you take a deep breath in and then out, and I'm going to palpate for your kidney on this side. Okay, once again. And then I'm going to let up real slowly and see if I can feel the kidney go back into place with my other hand. Okay, and then I'm going to try here on the left side, your left side, and then I'm going to switch up hands. So I'm going to use my right hand and then my left hand to palpate. So, yeah. Alright. Okay, and then one more time. Okay, once again, I'm gonna release slowly, and I'm gonna see if I can feel it with my other hand, slide back into place. Alright, so your organs were felt appropriately. I didn't feel any masses. They felt smooth, slightly firm, but yeah, no masses or any noticeable nodules or anything of that sort on it. So now we're done with palpation. We're gonna move on to some more specialized exams. I'm gonna have you sit up, and I'm going to check for polynephritis by making a fist and hitting it where your kidneys are at, in the costovertebral area on both sides. Any pain or tenderness?
No.
Nope. Okay, any pain or tenderness, like I said, would indicate potentially polynephritis or kidney infection. I'm gonna have you lay back down, and we are going to assess for ascites. So in order to do that, we would first test for shifting dullness. So I'm going to start slightly above your umbilicus, and I'm going to percuss outward. And then I would have you roll on your right side again, is fine. Okay. Okay, that would be a roll back. So you don't have any ascites, but if it was present, you would notice the tympany and the dullness move as the air-filled bowel floating in the ascites move to the side. So you would have tympany, the tympany would move from here to here, and then the dullness would move as well, which is why they call it shifting dullness. Next, I'm going to place my hand here. We're going to do the wave test for ascites. So I'm just going to percuss on one side, and then feel for a wave on the other, or feel for a wave on the other side. Agara, stop. Hey, stop. All right, once again, no ascites as noted. Next, we're going to test for a couple different appendicitis specialized tests. So the first one is Robsing's, and in order to do that, I'm going to press on your left lower quadrant, and just let me know if you have, you can lower your leg. There we go. I'm going to press on your left lower quadrant. Do you feel any pain or tenderness in the right side? Okay, positive sign would be pain or tenderness there. Next, we're going to move on to sore. Anyways, I'm gonna press here. I'm gonna have you lift up. Okay. Any pain or tenderness felt there? Okay. That would indicate a positive and then obsticator is the last one. So I'm gonna take your leg, I'm gonna bend it up, and then I'm going to internally rotate it, keep the knee medial. Do you feel any pain or tenderness? Okay. So you would have pain tenderness there because the obfuscator muscle is right over the appendix. So when you do that, it pushes pressure over that, so that'll cause pain. And then finally, can you just cough for me? All right, and no pain. All right. Okay, so then we would test for cholecystitis, and to do that, we would check Murphy sign. And to check Murphy sign, we I push on your right lower abdomen here, and then have you take a deep breath in. Are you having any pain? Okay, so a positive Murphy sign would be pain, sharp pain that went away on inspiration while palpating there. And then all right, that is it.